Prostaglandin analogs are some of our first-line glaucoma therapy because it works so well to control pressure. When the medications are working, we can expect approximately 30 to 40% pressure reduction. And not only do these medications work well, but patients tolerate these medications easily in that it's dosed only once a day. And so that makes it easy for them to remember and easy to do. There's hardly any bodily side effects to this medication, so that's nice as well. When we're starting out with these medications, what I like to tell patients to expect is that there can be a little bit of burning, irritation, redness, or even a little bit of blurring of vision for 1 to 2 minutes after installation of the drops. I ask patients to give time for their body to adjust. Often these symptoms will improve or get better as the patient continues to use the medication. Longer lashes is something that the ladies love. That's one of the side effects. Now, when I mention this to men, they're sort of impartial. I mean, they don't love it, but they often don't mind it. In patients with blue-green eyes or hazel-colored eyes, I recommend that patients think about whether or not they would mind if the eye color darkened a bit. Now, there's a small chance of that happening, but a patient needs to be okay with that before starting. Lastly, I like to tell patients that over time there can be some skin changes or soft tissue changes around the eye. And this is due to the drops wetting the skin around the eye. Now, to prevent this or to decrease the chances of this happening, I recommend that patients do one of two things. You can either put a tissue right under the eye when instilling the medication so that the medication doesn't wet the skin, the tissue catches all of it. So these are some of the considerations that I mention to patients and that I counsel for before we start prostaglandin analogs. These medications are commonly used. You may have heard some of them. Some common ones would be bimatoprost, latanoprost, travoprost.